Welcome to CrestCare Medical's e-learning session on basic CPAP operation. This is a standard CPAP machine that CrestCare Medical uses for most of our patients. It's a Respironics CPAP machine with an integrated heated humidifier. The first thing you'll need to do when you get the CPAP machine home is, of course, to plug it into electricity so we can operate the machine. What you'll get is you will get a cord that'll plug into your wall outlet. So I will plug that in right now. On the other end of that cord there is a little plug. There's only one spot for that plug to go. That's going to go right beside the permanent cord that's already in the back of your CPAP machine. So you just line it up to the outlet and plug it in. Now there is a small cord that will come off the back of the CPAP machine that's permanently attached. If that cord is unplugged, that goes right back into the CPAP machine, and there's only one plug opening for that. Once you have it plugged in, you can allow these plugs to remain into the machine, and you can let the machine plug in your electricity as well. You don't have to unplug the machine every morning. Now, every night before you go to bed, the first thing you're going to want to do is fill the heated humidifier up with water so it provides moisture into the air while you sleep. To do that, you're going to open the heated humidifier. There's a hatch right here. Simply lift it right up, and there's a clear water canister that's inside the heated humidifier, and that's where you will put the water. To fill it up with water, we need to take it out. So if you just grab the heated humidifier and give it a little pull, it'll slide straight out. You're going to stand it on its end, and you're going to fill it with water in either one of these two holes. Now, the water that you use is very important. It's recommended that you use distilled water, which you can purchase at the grocery store where they have spring water. If you use tap water and it's very hard, it could cause this canister to be damaged, ultimately leak, which could cause damage to your CPAP machine. So to prevent that, please use distilled water. Once you fill the water in either port, there's a black line on the side that shows you how far to fill the canister to. So you want the water to come up to approximately that black line. When it's full, you just lay it back on its side. The water will fill the jar, it will not spill out, and you'll insert it back into the humidifier. It only goes one way. The outlets go in first, so just line it up, give it a good push, and close your hatch. On top of the machine, on the right hand side above the humidifier, there is a large knob. Numbers go from 0 to 5. This is how we set the moisture level. The higher the number, the more moisture you will get. We start all our patients on a setting of 2 and advise you to go from there. You want to adjust this to your comfort, which means you don't want your nose to be dry. So if your nose is dry, you want to bump this up just one level at a time until that goes away. Now the next thing you're going to want to do, of course, is turn your machine on. There's 3 buttons that light up in blue. The middle button's the on and off button. So when you're ready to turn your machine on, you just simply hit that button, and you hear the air will come out of your machine, and it is running. Now there is a little hatch that lifts up on the side, and there's a screen. There will be a large number displayed here, and that's simply the pressure that the doctor prescribed for you. So every time you turn the machine on with the power button, it comes on to the full pressure. Now probably the most important button on the machine is the button to the left, and that's a ramp button. What that allows you to do is when you first go to bed at night, you're going to turn your machine on, it comes on to the full pressure, then immediately hit that ramp button. What that will do is will cut the pressure down to a very, very low level, which means there's not as much air coming in through your mask, so the breathing will be a lot more comfortable and allow you to fall asleep easy. What will happen is your machine will start very low, and it'll gradually ramp up or increase pressure very slowly over an approximate time period of average setting is around 20 minutes. So you'll have a 20-minute period where the pressure is not so much, allowing you to get used to the therapy. The other button on the front that's lit up in blue says C-Flex. This is a button that we're going to have this set for you, so you're not necessarily going to have to hit this button every night. What C-Flex does is every time you breathe out, the machine senses that you're trying to exhale, and it actually lowers the pressure a little bit right when you first start to breathe out, so it gives you a break. Breathing out can be a tricky part of the CPAP therapy to get used to, so when you exhale, if the machine gives you a little break, it's usually a lot more comfortable. That's what the C-Flex does. If you happen to hit the C-Flex button, you get a screen that says C-Flex setting, and there's numbers 1, 2, and 3. Those are the levels of C-Flex we can set. The higher the setting, the more relief you get. You'll see a little arrow that's blinking above one of the numbers. That's showing you what it's currently set at. Those levels can be changed by simply hitting the C-Flex button again, and you'll see that little arrow jump. We can set that to 1, 2, or 3, and we will set that at your setup time. If you want that changed, I advise you just to talk to the respiratory therapist and get their opinion on changing that. And we can help you do that as well if you would like to. These small buttons up here, we use to program that, and those really don't come into play for operating your CPAP machine every night. That is it for the features and the buttons that control the CPAP machine. If you have any questions, please call your local Crest Care Medical office and speak to one of the respiratory therapists. Thank you. Good enough.